SEWA AIFW, Meeting the Needs of the Community. Raj Chaudhary, Executive Director of SEWA AIFW, Asian Indian Family Wellness, a nonprofit organization committed to serving the South Asian community, emphasized how pre-existing partnerships with Minnesota Departments of Health, MDH, and other foundations provided opportunities for her organization to meet the multifaceted community challenge of the COVID-19 pandemic, including increased food security, inadequate shelter, sexual violence, mental health, and access to testing and vaccination. Despite these numerous challenges and keeping staff afloat, the organization was able to tirelessly respond to community during COVID-19 whilst promoting self-care amongst its staff. Leveraging pre-existing partnerships. MDH has partnered with SEWA AIFW since 2005. This collaboration was welcomed by the community as SEWA AIFW is a trusted organization in the community. Responding to COVID-19, SEWA AIFW organized virtual meetings and webinars such as Building Resilience and Strengths During Uncertain Times, and other events in conjunction with partner experts. These sessions help to communicate about COVID-19 and legal information about the travel ban affecting many community members. Furthermore, podcasts and materials were produced in native languages to deliver COVID-19 messaging, address myths and misconceptions. They also address domestic and sexual violence, disability, and leverage their referral system to provide peer-to-peer support in the community. Information was also communicated through in-person and virtual health clinics, telehealth program, and referral screenings and consultations, reaching 500 and 5,000 people, respectively. Through mobile units, MDH continues to support their testing, vaccination, and resource sharing efforts across partners. SEWA AIFW partnered with MDH and Hennepin County Public Health to distribute personal protective equipment kits, hundreds of saliva kits, 15,000 masks, and 5,000 hand sanitizers to temples, churches, and mosques and communities. They also worked with MDH to provide mobile units to help support testing, vaccination, and outreach events. Despite that community demand was greater than capacity, partnerships were helpful in facilitating assistance to communities, said Chaudhary. Looking forward, maintaining and sustaining all the great relationships and networks into the future is needed, said XP Lee, COVID-19 Community Coordinator, CCC lead. Many valuable lessons were learned from working with communities that could be applied and be of benefit in other areas. Similarly, Vu Day, CCC supervisor, observed how there is still room to develop more networks and partnerships to reach out to some API communities that are not well represented and where services have not reached, concluded Vu Day, CCC supervisor. SEWA AIFW continues to receive regular calls regarding the COVID-19 testing centers and where to get booster shots from, resulting in 300 people having received boosters through their clinics. Dasharat Yata, Assistant Director of SEWA AIFW, noted that they received recognition from the community in doing COVID-19 vaccination by receiving an award from 3 regional nonprofit and cultural organizations. The staff continue to receive thank you notes and text messages of appreciation from the community. An emotionally fulfilling moment of this work was witnessed how one Hindu man finally received a shot after being convinced of the importance of being vaccinated before he could see his grandchildren, whom he missed, recalled Mubina Qureshi, Gender and Health Equity Programs Manager. The shot was the man's first injection in his life. Reflecting back, MDH's ability to reach out to affected communities during COVID-19 is mostly due to its pre-existing and trusted relationships with various community partners prior to the pandemic. It was important for the team to work with organizations they trusted to reach out and connect to communities. Vu Sinsai, former MDH Asian and Pacific Islander API Community Liaison team member, confirmed how such partnerships have been unique. In making the API Community Liaison team nimble in their response to community needs and requests, MDH's partnership with SEWA AIFW is a testament to how identifying trusted existing partners is crucial, as API Community Liaison lead Du Zong Yang believes.